Coronavirus cases are on the rise in Missouri as new numbers come in. Good evening. Thank you for joining us. I'm Steve Savard.
I'm Samantha Jones. As more tests become available, we're getting a clearer picture of the disease's spread across the St. Louis region. I want you to look at this map. It shows the most current numbers in parts of the St. Louis area. There are 12 confirmed infections in St. Charles County. In St. Louis County, there are a far higher number there, sitting at 129. There are 44 cases in St. Louis City, and for the city and county, that's dozens more confirmed infections than yesterday. In response to the outbreak, Missouri Governor Mike Parson is asking President Trump to approve a major disaster declaration. This would provide federal assistance to the state. And here's a live look at Capitol Hill tonight as lawmakers continue squaring off on a way to pass a $2 trillion stimulus bill to boost the economy. The holdup right now is in the Senate.
Our team coverage of the coronavirus outbreak continues tonight. We'll start with Ray Preston, who spoke with a woman who's calling on the governor of Missouri to close a state office building in the city of St. Louis.
The historic Wainwright building in downtown St. Louis has hundreds of state employees that work here. Now, an employee who says that they work with the state mental health department says that on Tuesday, several workers met with an administrator and supervisor. Now, this employee asked that we not reveal their identity.
We were to leave because we had been exposed to someone who tested positive for COVID.
The employee tells News 4 that there are perhaps 200 workers with the mental health department that work on the 6th and 8th floors of the building.
We all use the same fax machines. We all use the same scanners. We all use the same copiers. We all come in through the same door. We ride the same elevator.
Wednesday afternoon, while the building was closed to the public, we did see food being delivered and people leaving. The employee says they believe Governor Parson should order the entire building closed.
And totally clean it and totally disinfect it. And everybody should be quarantined for 14 days. If we were exposed, we've exposed everybody else.
The employee says members of a cleaning crew that arrived to sanitize parts of the building were not told they were dealing with COVID-19.
The cleaning crew came up and started spraying things. But as they were spraying things, they did not have on protective gear other than gloves. They did not have on masks or anything. And when I asked them about that, they said that when they came up to clean our offices, they were not told exactly why they were cleaning them.
The employee says they are now in self-quarantine for the next couple of weeks, taking their temperature twice a day and being aware of other COVID-19 symptoms. In downtown St. Louis, Ray Preston, News 4.
We want to share some information just coming in from St. Charles County. 3 residents at a senior center have tested positive for coronavirus. Frontier Health and Rehab is located near I-70 and Zumbell Road. One woman is in her 70s, another in her 80s. Both are hospitalized. The third patient, a man in his 50s, is in quarantine. Frontier Health has eliminated all outside visits and dining rooms are closed.
A lot of restaurants are hoping help comes soon from Washington. We mentioned earlier how the passage of the emergency stimulus has hit a snag in the Senate. There's a lot in that $2 trillion package. Here's what we've found is in it. There's $500 billion targeted for distressed companies, so that would be something like Boeing. Then there's $350 billion for small business loans. That would be like the restaurants we mentioned. $250 billion would be direct payments to you. $1,200 for those earning $75,000 or less per year. $2,400 for married couples earning $150,000. And there's $500 additional per child in your family. Steve?
Sam, Washington University doctors are working on a treatment for coronavirus. It centers on a century-old idea on how to treat a disease, taking antibodies from the blood of recovered patients and giving them to sick patients. It's a way to reduce symptoms and prevent the worst parts of the virus, like difficulty breathing, which has created an urgent need for ventilators across the country.
We were inspired to bring back this relatively old method is because we have so little time to respond to this new disease. We're hopeful that vaccines and new drugs become available, but it's going to take time to develop those. And if we are using the plasma of people who have recovered, that's something we can do right now.
So doctors across the country are looking for recovered patients who could donate plasma. The donors need to have tested positive and been in recovery for 2 weeks.